public session. I'd like to apologise to the Minister and his officials for the fact that we're coming to you considerably later than anticipated, but we're doing our very best with time. I suppose I should read out the privilege warning. I would welcome the Minister for Health, Stephen Donnelly TD, and his officials from the Department of Health to our meeting this afternoon. I won't go through the privilege warning, if that's okay. I think, Minister, you've sat through enough meetings at this stage to probably have a rough idea of where it stands. I would ask that the Minister make his opening statement, and I'd ask that you confine yourself to 5 minutes to allow as much time as possible for questions and answers. Thank you. And again, thank you for your forbearance. Apologies for being late. Thank you.
Thank you very much, Chair. Chair, members of the committee, I welcome this opportunity to update the Special Committee on Ireland's ongoing response to COVID-19. You've heard earlier today from the HSE, from the Acting Chief Medical Officer, Dr. Glynn, and from Professor Nolan about Ireland's operational response to COVID-19 and the prevalence of the virus in our country at this time. I'd like to take this time, therefore, to update you on Ireland's approach and the priorities from now until Christmas. Earlier this year, Ireland and countries across Europe locked down as COVID spread relentlessly through our communities. Around the world, tens of millions of people have been affected and hundreds of thousands of people have lost their lives. Many lives have been lost here in Ireland as well, and we mourn every single one of them. It's been a very difficult year for everyone, and absolutely heartbreaking for those who've lost family and friends due to COVID-19. People across the healthcare system have worked tirelessly to prepare an already overburdened health system to cope with COVID-19. The people of Ireland worked every day and sacrificed much to comply with the lockdown, keep essential services running, and to flatten the curve. As countries across Europe began to open up, COVID-19 started to spread again. Countries across Europe are now acting to suppress the virus, and here in Ireland we are doing the same. The first chapter in our fight against COVID-19 was focused on flattening the curve. The country was locked down. Schools and colleges were closed. Businesses were closed. Much hospital and community care was stopped. People isolated by staying at home. Sports, arts and community activities were cancelled. This approach did flatten the curve, but as we all know, it came at a huge cost. We're now in the second chapter of the fight against COVID-19. From now until at least Christmas, our focus is on suppressing the virus to allow us reopen society, reopen schools, reopen colleges, reopen health services, protect jobs, and protect those who are most vulnerable to this awful virus. Because we know more about the virus now, it has been possible to bring in localised measures where cases grew locally. And it's been possible to bring in national measures as necessary to limit the suppression of the virus through targeted national measures. Because tens of thousands of tests are being done every week, it's been possible to act quickly and to suppress the virus as it tries to move once again through our communities. Last week, we learned something very, very important. Thanks to the amazing efforts of the people of Kildare, Laois and Offaly, we know that localised measures can work, and it is without a doubt that the people of Kildare, Laois and Offaly have saved a lot of lives. They've saved lives in their own community, and by helping suppress the spread of the virus around the country, they've saved lives all over Ireland, and for that we owe them a debt of gratitude. We know that measures that avoid lockdown by seeking out and minimising the situations in which the virus spreads are what we now want to use. That's the approach we're using across Ireland. Targeted measures to suppress the virus while keeping as much of our society and as much of our economy open as possible. In my own department, in health, we are preparing for the winter. A comprehensive winter plan is being developed and many measures are already in place. As has been the case from the first day COVID arrived in Ireland, government decisions are informed by the recommendations and advice of the National Public Health Emergency Team, NPHET. NPHET monitors the evolving evidence both here in Ireland and around the world. They in turn are guided by recommendations of the World Health Organization and the European Centre for Disease Prevention and Control, and we are grateful for their assistance. Chairman, members of the committee, thank you for this opportunity, and I look forward to a good discussion with you in the coming hours on COVID-19.
Thank you very much, Minister, and thank you for being so timely. Deputy Cullinan, you're taking 10 minutes, I take it, or are you not?
Indeed, yep.
Yeah, go ahead. You have 10 minutes.
Thank you, Minister. You might have seen I was wearing my 24/7 cardiac care mask for Waterford. I'm sure you haven't forgot about that campaign. First of all, can I welcome you and welcome your team? And I have a lot of questions to get through. I have 10 minutes, so as an experienced politician, I'm sure you'll know I need distinct answers to the questions if that's possible, Minister. I know we're dealing with very complex issues as well. My first question and the first topic I want to deal with is the preparedness for the coming number of weeks and months in our acute hospitals. And obviously we're dealing now with COVID care, non-COVID care, missed care, the need for catch-up care and so on. So the first question I have is, what is the anticipated shortfall in acute bed capacity arising from hospitals not exceeding the 80% capacity to ensure that we have surge capacity, and also because of infection control and social distancing measures? So how many beds is it anticipated that there may be a shortfall in because of those measures? If you have that figure, please.
Thank you, Deputy Cullinan. Can I give you the critical care capacity first? Because I think in terms of surge capacity for COVID-19, that's a figure that the HSE and the clinicians are focusing on very, very strongly. So as we know, the critical care bed capacity in our system before COVID arrived was 255 beds. That's 204 beds, ICU beds, intensive care beds, and an additional 51 HTU beds, or high dependency unit beds. At the height of the surge, the capacity for critical care beds was approximately 500. As of this morning, the total capacity in critical care beds is 302 beds.
Can I just stop you there, Minister, and welcome that? And we need as many critical care beds as we can get. But I do want to bring you back to the number of acute hospital beds and the advice that you've been given in terms of what is the anticipated shortfall or the anticipated lack of capacity, bed capacity, acute beds, because of the 80% rule of not exceeding 80% capacity and social distancing guidelines. What figure have you been given?
So, Deputy Cullinan, the winter plan is the process by which the HSE is doing the...
I know that. I've asked you for a figure, Minister.
Yeah, the winter plan is the process by which the HSE is doing the detailed modelling on that. The reason...
do you have a figure today?
The reason, Deputy, there isn't a figure today is because we are learning very, very quickly about this. So, for example, in your question, when you and I learnt about this first, the figure we were both given was that the hospitals couldn't operate at more than 80%. That was based on a variety of advice from the HPSC, including, for example, 2-metre distancing. Over the last number of weeks and through the next few weeks, which is why we don't have a figure yet, an awful lot of detailed work is going on.
Minister, can I bring it? Did you read your own ministerial brief?
Yes, Deputy, I did.
See the figure that was in the ministerial brief? Do you know what that figure is?
Deputy, what I'm saying to you is...
No, I'm asking, please, Minister, I'm asking a very straight question because this is a very serious issue. Did you read your ministerial brief? And if you did, can you give me the figure that they say will be the potential of lost capacity in your own brief that you were given in terms of for all of those reasons?
The HSE is approximately 11,000 beds, and 20% of that would be approximately 2,200. But Deputy, what I'm
That's not what they say. So I'll read it for you, Minister.
What I'm telling you, Deputy,
I'll read it for you, so at least we're clear on what the figure is.
The 80% figure is an old figure that doesn't apply. So, for example, occupancy in the acute system right now is approximately 96%.
Okay, so what your ministerial brief says, Minister, and we can only go on the information that we're being given by your department. It says, and I'll quote, the HSE is estimating a 20% decrease in targeted inpatient cases for 2020. It has also estimated that there could be a shortfall in capacity due to safe distancing requirements and reducing utilisation to 80% of 4,700 beds, based on a current baseline of 11,000. 4,700 beds. Now, I put in a parliamentary question looking for a breakdown on a hospital-by-hospital basis, and the response that I got back was that the department says that I regret that the information is not collected in the form that you require and is therefore not available as requested. So if we can't even get a breakdown of what that will mean in each hospital or each hospital group, and we're trying to plan as well and to support government in terms of what solutions are in place, whatever the figure is, I think we can agree we're going to lose capacity. And what people want to know, and what frontline healthcare workers want to know, is how we're going to replace that capacity. So if the figure is as bad as they say it is, and it is 4,700 beds, how is that shortfall in capacity going to be made up, and where is the plan to make up that capacity?
So, Deputy, what you read out was that the HSE has 11,000 beds, and we need to move from about 100% occupancy, which is unfortunately where we were at, to about 80% occupancy. That would require 2,200 additional beds. What I'm saying to you is, thanks to an awful lot of good work in every hospital and by central HSE working with the HPSC, the additional number of required beds has reduced from that very high figure, and they don't yet have a final figure. That figure is being produced, Deputy, with the winter plan. Now, as you
whatever the figure might be, Minister, my question now is, because we can only work on the figures we're given, my question now is, there is going to be lost capacity, so how are we going to replace it? What are the options that are on the table here? When we know every single winter there is a crisis in our acute hospitals, every time. And if you're dealing now with COVID, non-COVID care, catch-up care and reduced capacity, we have a perfect storm coming at us, and we need more beds and more staff in the system. So in terms of beds first, how are you going to inject more beds into the system?
Well, can I say, thank you, Deputy, and can I say the challenge is wider, obviously, because it's not just acute beds, it's primary care, community care, inpatients, outpatients. This is exactly what the winter plan is looking to do. It is being produced several months early. It will be the most comprehensive winter plan that has ever been launched. And because of the costings involved, as I'm sure you'll appreciate, it's not going to be cheap. It will require discussion.
I produced my own plan, Minister, by the way, and I did send it on a copy to your office. But the question I asked was, and I appreciate there needs to be a winter plan. With respect, Minister, the question I'm asking is, what are the options in terms of increasing bed capacity? Yes, we need more investment in primary care. Yes, there's more supports for people with disabilities. Yes, we need to do more in nursing homes, but I'm specifically dealing with acute hospital beds with respect. And I'm asking, you can't give me the figure as to exactly how many beds will be lost, but surely you have an idea about how you're going to replace that capacity.
I do, Deputy. So let me tell you some of the things that are happening already. So already home care packages have been increased by 2.6 million hours. These are all COVID measures. Community assessment hubs have been introduced. There's 29 teams. The number of acute hospital beds that's been increased this year is 400 in order to deal with the additional capacity, and I'm seeking funding to maintain that all 400 of those beds stay open. We have additional critical care capacity of 42 beds. 1,600 nursing staff have been upskilled to support critical care. There's been an increase in the number of intermediate care beds. We have 700 open, and I'm seeking that they would all stay open. As you know, there's been enhanced infection prevention and control, PPE, cleaning and disinfectant. There's also, Deputy, as I'm sure you'll appreciate, part of your very reasonable question is how do we increase bed capacity? The other part of it is how do we keep as many people as possible out of the hospitals? The clinical hubs are working very well. We're looking for them to continue. The mental health support desk has been working very well. We're looking for that to continue. And obviously we're upgrading a lot of other supports around that at the same time. So supports for GPs, new GP contracts, safe staffing levels for nursing, and many more complementary measures as well.
Well, Minister, can I say to you, in the ministerial brief, it also says that even if we were to take all of the capacity in the private system, every single bed, it still wouldn't be enough to make up the shortfall. So I think there's an urgent need to bring this plan forward. And two final questions I have for you. The Be On Call for Ireland, and the latest figures I got at the end of July was that there was 1,639 frontline staff available to come into the system, 260 nurses, 341 doctors, 228 healthcare assistants. How many of them since the end of July have actually been offered work? People will find it extraordinary that we have 1,600 frontline workers that could be brought into the system, and we're also being told that there are some beds that are not operational because we don't have the staff. And people are just amazed as to how we can have nurses and doctors and healthcare assistants available in what's called a pool to come in, and they're not there. And my final question, if you get a chance to answer this as well, is that you will know that there is a high-profile campaign by cancer patients and by others for medical cards for patients who are terminally ill. I think there was a report that's due on your desk in the next number of weeks. Can you give us an indication when that will arrive? And is this something that you still support? And is this something that we may well see in the budget coming up this year as well? Thank you.
So, Minister, could I ask that you answer the first question, how many have been employed, and provide a written answer, maybe, because it should be a short answer, how many have been employed, and provide a written answer to the rest to Deputy Cullinan.
Can I say, Chair, first on the winter plan, can I agree wholeheartedly with Deputy Cullinan? The challenge that we are facing cannot be underestimated, and as the Deputy has pointed out, there is a very real reduction in capacity in the public system, and I look forward to engaging with the Deputy and the Oireachtas on that winter plan. Deputy, I'll send you a detailed briefing in terms of the frontline workers, but my priority on nurses is that we reach the safe staffing levels that were agreed last year. The nurses and midwives went on strike. Deputy Cullinan, you and I joined them on the ballot for that strike. A Labour Court recommendation was agreed. Progress hasn't been made. My priority when it comes to nursing and midwifery staff is that agreement is honoured and we reach these safe staffing levels much quicker than has been happening to date.
Thanks, Minister. Just on the question, it was a very specific question.
How many of them have been given a contract?
Ireland On Call people who came back from Australia, wherever, how many have been employed? Because it's something that
I'll get the committee a detailed briefing on that, Chair.
Maybe today is Wednesday, by the end of this week?
I'm sure, no problem at all. Yep.
The next speaker is from Fine Gael, Deputy Burke. 5 minutes, is it?
5 minutes, yes.
Yep, thanks.
And followed by Deputy Durkin immediately then.
Yeah, but there's be a Fianna Fáil speaker in between.
Thank you very much, Minister, and wishing you well in your role as Minister. It's not an easy task, and also to all of your staff in your department. Can I just ask, Minister, you were saying in your submission here today, you were saying a comprehensive winter plan is being developed with many measures already in place. I'm surprised that we didn't get a list of those measures that are in place. So could we have that as well, that it would be set out in writing as regards what new measures are already in place, which is set out in your script, because it hasn't been given to us. So could that be sent on to us? The second issue I want to raise is in relation to hospitals and capacity in hospitals. Down in Cork a few years ago, we had a difficulty with a huge waiting list in relation to gynae services. A lot of them were daycare procedures, and we were able to rent space in them out of private. Consultants went down there, did the daycare procedures. Is there any provision being made where we can rent space in other medical facilities to allow, in particular, daycare procedures to be dealt with? What plan is being put in relation to that, and has there been engagement with the private sector in relation to getting space? And it's not necessarily getting consultants in those facilities to do the work, but where there's a lot of consultants complaining to me they can't get operating time, they can't get daycare procedures done. What's being done in relation to that? The second issue is in relation to the issue about consultants' pay, and as regards recruitment of consultants, what progress has been made on that issue? If you're not able to give me an answer on that today, then that I would get that answer in writing at the earliest possible date. And as regards the recruitment of consultants, has there been any fast-tracking done in relation to recruitment to deal with the vacancies that exist? The third issue is in relation to nursing homes. There is a support scheme in place already for nursing homes. I raised this earlier with the HSE. I'm just looking for clarification, and again, could that be set out in writing in relation to there is a whole lot of additional costs now in relation to nursing home, and remember they have over 25,000 people that they're caring for. So I'm just wondering, can we get clarification on that? And the final one is in relation to the NEPID, about the fact that a sector which is looking after over 25,000 people is not in NEPID. Is that going to be revised? And I'm talking about a representative from the nursing home care sector in it.
Thank you very much, Deputy. In terms of the measures that are in place, absolutely. I read out several of them for Deputy Cullinan, but we will get you a full list of the measures that are already in place. In terms of the private hospitals, where we're at is this: a €25 million bridging fund has been created, and the HSE is using private hospital facilities right now, right across the system, based on medical priority. Tenders have issued from now to Christmas and potentially beyond to all private hospitals. We're tendering for diagnostics, we're tendering for services, and we're tendering for surge capacity. And I have no doubt that the examples you give in terms of tendering for facilities, but not necessarily for consultants, is incorporated into the thinking on that. What I want to see, Deputy, is that we avoid the situation we had earlier this year. I fully understand why it was done at the time, in the heat of the moment, in a full-blown crisis, and there's no criticism of the action taken, but I think it's clear that it didn't work in terms of ongoing support. It did, of course, work in terms of creating surge capacity very, very quickly. So I want to make sure we avoid the block purchase of resources that happened last time. In terms of consultants, a lot of progress has been made, but let's remember that we have over 500 consultant vacancies right now, and if we are to get to a decent level of consultants per population, right now we've the lowest in the OECD. We have to do an awful lot more than just fill the vacant posts. C contracts have been signed off recently that hadn't been done for quite some time. I hope to have news to share with you soon on public health doctors and transitioning them to where they should be and where they deserve to be, which is as consultant grade doctors. The Sláinte Care contract is a priority for this term for the government, and we're looking at the new entrant pay inequality issues that have been discussed in the Dáil for quite some time. In terms of the nursing home support scheme, as you'll be aware, with the permission of the Dáil, it was extended, and that had the support of Nursing Homes Ireland. We will get you a full briefing on that. And can I say, Deputy, in terms of nursing homes, 2 weeks ago, I believe it was, maybe it was last week, the Nursing Homes Expert Group report was launched. Very comprehensive, 86 recommendations across 15 themes. The implementation team has been set up. We have continuity advising that team from people who were involved in the expert group, and we will be putting a package of recommendations together, which I'll be bringing to the Oireachtas for debate.
Thank you. Thanks. The next speaker is from Fianna Fáil, and it's Deputy Murnane O'Connor.
Okay, thank you, Minister. I have 4 questions, so I'll get to them as... I have 5 minutes. Yeah. I have 4 questions. Minister, have we been set up for random testing at the airports? Are we looking at random testing in our schools? Because I think this is very important now with all our schools going back open in the next few weeks. I know that next week we're all sitting, which is welcome, but I'm asking you about legislation. Over the last few months, we would have seen the guards didn't have any legislation to actually enforce the restrictions that needed to be restricted. Is it a priority of yours that next week that we get this legislation through so that it gives the guards the power to make sure that they can legislate? I think they're called primary law, that we need them. We need to make sure that we have someone that can actually go out if there was a house party, if there was people overcrowding, to give the guards the law that they can do this, and they don't at the moment. I was speaking to one particular guard recently and he said, Jennifer, at the moment we don't know where we stand, and it's not their fault, like yourselves, they're doing a great job, so you might come back to me on that. And the other one I want to ask you about is you spoke about care homes and nursing homes, and I know yourself and Minister Butler launched the nursing home, the policies and the plan going forward, but I'm actually at the moment, Minister, dealing with care homes. They're Section 39. And there's huge issues there with them, Minister, in the sense of funding, but also even on the bigger scale, the CE schemes, they're finding it hard to get workers. And if we don't get funding for the Section 39s, I would have a fear that some of them across the country will have to close. And my last question is, Minister, what is our roadmap going forward for the GAA Sports Club, for our wet pubs which haven't yet opened, for our dance studios who have contacted us all, where they normally had 50 indoors, then 15 and 6? Minister, I just want to say to you, legislation, information and testing, if we can actually deliver on that, and we're doing well, but I think we need to do a lot more, we could actually give people back the confidence that they need. We could make sure that people know, look, this is our message, we are going to get over this and we will do that. Thank you.
Thank you very much, Deputy Monnane O'Connor, for your questions. There are several there. I'll cover as many as I can, and I'll get you written responses if we don't. With regard to testing and tracing, it is a key weapon in our arsenal. We rank well by international standards. The HSE has been ramping up very significantly. We had about 52,000 tests or thereabouts last week. We had one of the days last week was the highest number of tests ever conducted in Ireland. We have serial testing being rolled out in nursing homes, in direct provision and meat processing plants. There's a lot of community testing going on as well. As you say, randomised testing will be introduced shortly to the airports. With regards to school, Deputy, the public health advice is against that, and we are obviously led by the public health advice in that way. So if there is more information that can be provided to the public and to the Oireachtas on an ongoing basis in terms of testing and tracing, we will certainly endeavour to do that. And Chairman, if the committee has views on that as to how we could be helpful, please let me know. In terms of the wet pubs, can we just call them pubs? Because the public health advice is very clear. Pubs can't open right now, and I really do understand the pain and the anguish and the suffering that is causing for so many publicans and their staff around the country. But based on public health advice and what's required to suppress this virus and avoid a second lockdown, that is the very clear position of the National Public Health Emergency Team. What they have said is that restaurants can open. So it's not wet pubs, it's pubs and restaurants. Some pubs are operating as restaurants at the moment, which is good and fine. And the international evidence is that we do not see a lot of clusters coming from restaurants, which is why the recommendation from NEFIT was that they open. However, it is my firm view that the moment it is deemed safe for the pubs to open, they need to open. With regard to the GAA, Deputy, could I say I heard a lot of criticism from the GAA, including singling out the Chief Medical Officer, which I have to say I take exception to. The Chief Medical Officer's job is to advise me and to advise government, and his only focus is on saving lives. The easiest thing in the world for NEFIT to do would have been to say, just close down all sports. We're at a tipping point. We could be looking at another national lockdown. We have to take this deadly seriously. And it would have been quite reasonable for them to say, for the next 3 weeks, in order to protect the country and lives, we simply have to stop sports. To their great credit, they didn't do that. they said they recognised the incredibly important role sports play in our communities and for our country. And they said, for that reason, everyone can train. All matches can go ahead, because the advice they have is that in the playing of the matches and the training, that's not where the virus is spreading. All they recommended was that for 3 weeks, people didn't spectate. Obviously, people can be there for child protection and child safety reasons. But I hope that message is heard by the amazing sporting institutions in this country, be it the GAA, the FAI, the IRFU, and all of the others, is that the public health advice was to protect these organisations and protect sport, and ask only that for a short period of time spectators weren't there because the evidence is that there are cases associated with activity before and after training and matches.
I'd like to bring in the next speaker, who is Deputy Durkin.
Thank you, Mr. Chairman, and thank the Minister for attending this particular session, and compliment him and his staff for the work they're doing and wish them well. Can I ask, in relation to taking again to go back to parochial, the Kildare example, if you were to identify one single issue, Minister, which might have contributed to the upsurge in Kildare, what would it be? Would it be a lack of attention to social distancing, and given that the pubs are not open and haven't opened, not going to open in the near future? Was it house parties, or was it lack of attention to hand hygiene or whatever? If you could give us some indication in relation to that, Mr. Chairman, Minister. And could I also ask, in the future, given that we're facing into the winter, and arising from the possibility that a single issue was a contributory factor in the recent outbreak in the Midlands, Kildare and adjoining counties, can you be absolutely certain of the ability of the system to deal with any further outbreaks that might take place in the community, in schools or adjacent to schools, or clusters or meat factories? And do you have the capacity to do that, and do you have the capacity to do it quickly? And the last question, a number of people have raised the question about the pubs, and I know what's been said. But in the absence of pubs as a social centre for the public, there's a tendency to seek alternative locations that are not under control at all. What do you say, Minister, to the publicans who say that they can achieve social distancing without any difficulty? There will be some pubs that cannot, but those who can, and they are prepared to provide a service that is supervised as opposed to unsupervised service, and as a result a safer place for a social outlet for the public. What do you say to what their submission, Minister? And the last point is in relation to the winter plan and the degree to which, and two issues. One is special needs children and the ability to provide the necessary services for them, particularly in relation to children with autism. And there's strong evidence to suggest that the lack of attention to the details, such as speech and language therapy, for example, children their condition has deteriorated sharply. And to what extent can you address that in the short to medium term, Minister, and do you intend to?
Thank you very much, Deputy Durkin. Your first question, very understandably, relates to what happened in Kildare. How did we get so many cases so quickly? The advice I have is that it is a combination of factors, that it is a combination of what are high-risk workplaces in terms of COVID. That's the experience in Ireland. Nearly half of the workplace clusters to date before this happened had been in meat processing plants, and it is the experience around the world. A combination of that, it's believed that travel may have played a part in terms of workers sharing commutes to and from work. Accommodation, it is believed, also played a part in terms of congregated settings. But can I say, Deputy, that the public health experts, when I ask them exactly this question, are at pains to say that there are a lot of other unknown factors. So, for example, there may have been a super spreader or several super spreaders. They don't know that. I think, and I'm sure you'll agree with me, it's very, very important that we don't, in trying to identifying what happened, lay blame anywhere. The only thing that is to blame here is a deadly virus, and we are in the middle of a global pandemic. In terms of testing and tracing, a lot of good work was done, and I know the committee spent a lot of time on this in the earlier sessions. What is true is that due to the speed and significance of the number of additional cases that happened in Kildare, Laois and Offaly, the tracing time did slow down. And we need to make sure that that doesn't happen again. It happened for a very understandable reason, which is that frontline clinicians were deployed back to their jobs. However, I can share with the committee that the tracing team is currently ramping up from what was about 50 or 60 when the outbreaks in Kildare happened to 150 plus by the end of this week and more. My priority is that as the schools go back, and as we ramp up very significantly in terms of serial testing for meat processing plants, direct provision nursing homes, and as our community testing is high at the moment, is that we maintain very, very high turnaround times.
Could I have written replies maybe to the question of the special needs support for the children?
Deputy, yeah.
Winter and the winter plan.
Thank you. The next speaker is from the Green Party.
Thank you, Chairman, and thank you, Minister, for attending today. I have 4 questions. I'll try and get through them quickly. We've just 5 minutes. First one, a colour-coded alert system has been introduced as an alternative to the previously published roadmap for reopening. Does your department have a date for the publication of this system? What can the public expect from this system, and will there be restrictions tied to specific colours, etc.? Secondly, data in relation to hospital-acquired COVID-19 infections was released at the end of June. There were 265 cases of hospital-acquired infections, so about 8% of all hospitalised COVID-19 cases. The latest data from the Health Protection Surveillance Centre has identified 8,563 COVID-19 infections in healthcare workers, which is about 31% of all COVID-19 cases. As we move into a potential second wave of COVID-19, what work is being done to reduce the spread of COVID-19 within our healthcare facilities? Will there be a lessons learned report on hospital-acquired infections and the high levels of COVID-19 infections among healthcare workers? Thirdly, how is your department ensuring there is a minimal disruption to medical services in the event of a second wave? Is your department considering using the private hospitals as we have previously done? And my final question, Minister, in their meeting on Thursday, 6th of August, NPHET discussed alternative testing pathways for children. The standard nasopharyngeal, oropharyngeal specimen is upsetting and off-putting for many children and their parents and guardians. The alternative, less precise oral fluid or saliva specimen was discussed in recognition of this being more appropriate for children. Could your department clarify if you have received recommendations from NPHET on alternative specimen types for testing children? As we move closer to the reopening of schools, could your department prioritise this issue? Thank you.
Thank you very much, Deputy. To be clear, the colour coding system is currently a proposal from the National Public Health Emergency Team. It's for consideration at a government level. Government is currently putting together the new detailed roadmap, and that will be available for debate and discussion with the Oireachtas in the coming weeks. But regardless of what is decided in terms of the new roadmap, between now and Christmas, we're essentially in a new chapter. And the strategy is this: follow the public health advice, suppress the virus to keep society and the economy open, use localised approaches where we can, and thanks to the people of Laois, Kildare and Offaly, we know work, and critically target the measures at the areas and the activities where we know the virus spreads in order to protect everything else in our society and economy staying open. With regard to healthcare workers and infections, I agree. It looked and looks like a very high number. Any healthcare worker who's infected is one too many, quite frankly. And at the start of this, there is no doubt, but that the level of infection prevention and control measures now in place was not in place. That's not a criticism of occupational health or the amazing healthcare workers around our system. It's a novel virus. It hit us very quickly. We hadn't dealt with anything of this scale before. I can assure the Deputy that very, very rigorous infection prevention and control measures are now in place. However, we must never stop and say this is enough. We have to keep going every day, every week, and tightening up on the protections, not just for our healthcare workers, but for our patients, not just for those working in the nursing homes, but for the residents and so on. Deputy, you ask a very important question that weighs on my mind a lot, which is what happens to healthcare services if there is a second wave? The short answer is nothing good happens. As we all know, before COVID arrived here, we had the longest waiting lists anywhere in Europe. And the new information on how long they have now become because of the elective care that had to be paused is very, very sobering reading. One of the reasons the winter plan that we are going to propose is so comprehensive is to be able to deal with COVID and have surge capacity, be able to get the healthcare system running to deal with day-to-day demand, and ideally start looking at these lists as well. Of course, we will minimise the disruption to healthcare, but let's be very clear. If we are dealing with a serious second wave of COVID in this country, healthcare services will, for a second time, be severely curtailed. It's why, Deputy, the message is so important for us to get out right now, that we are at a tipping point. If we all comply with the healthcare advice from NPHET, as the people of Kildare, Laois and Offaly have shown, we can suppress the virus. The best way we can all protect healthcare workers, the best thing we can do to make sure that our hospitals and our community settings stay open is to suppress the virus in the community. And I'll get you a written response, Deputy, in terms of the saliva test. The short answer is yes, it has been discussed by NPHET.
Thanks, Deputy. The next speaker is from the Labour Party, Deputy Smith.
Thank you, Chair. Thank you, Minister. Look, I'm perplexed as to what's happening here in this session. We asked you a couple of weeks ago to come to the COVID committee and you were unable to, and you're coming today. I'm not sure if you're aware of it, but you're the main event today, not just for the committee, but for the people of Ireland wanting to see a plan and some certainty. And what we got today was a 3-page opening statement, which was well spaced out, I have to say a lot of gaps, that was sent a half an hour before the session began. There's no submission, there's no further detail, and even within this 3 pages, and a lot can be said within 3 pages, there's nothing within these 3 pages that gives people any kind of clarity or guidance as to what they are going to have to do over the next, to use your at least until Christmas timeline. It is deeply, deeply concerning. You're talking about a winter plan a number of times already today. The Chief Executive of the HSE explicitly said in response to me today that we're not referring to a winter plan. He pulled me up on it earlier today. He said we're not referring to a winter plan this year. It's not that. We're looking to managing our services through winter and into next year. That we're in a totally different sphere, a totally different realm, and I'm wondering, are you even talking to each other? In your opening statement, there's no mention of direct provision. There's no mention of meat plants. There's no mention of travel restrictions, how travel is going to work. There's no roadmap, Minister, there's no mention of the roadmap. You're mentioning Kildare, Laois and Offaly, okay, which I think is quite disingenuous. If Kildare, Laois and Offaly are going to be the pilot system for what we're going to be doing between now and Christmas, then I'm deeply concerned. The previous speaker asked about a roadmap, and you said that a roadmap is going to be presented to the Oireachtas for discussion in the coming weeks. How's that going to work? We're all going to thrash around a roadmap across the floor of the Oireachtas for a number of weeks before it's delivered. It's up to you, Minister, on the advice of NPHET, to deliver a roadmap so we all have certainty. We require leadership on this. So I'm absolutely at a loss in terms of where we're going here. So just, I suppose, to take what little detail you have provided, on the localised approach, on the county-by-county approach, how would it work for a county like Dublin? God forbid there's a big outbreak in Swords or Balbriggan in North County Dublin. Is the whole of County and City of County Dublin going to be shut down and closed down? Like, will the people in Shankill and Dundrum be shut down, whilst the people in Ashbourne and Drogheda, which are not 3 or 4 miles away from those towns, are going to remain open? How is that going to work, Minister?
Thank you very much, Deputy. Can I just correct several incorrect statements that you made there? First of all, I was available to come to the committee. The Chair and I had detailed communications on this, and I'm more than happy for you to discuss that with the Chair. So that is absolutely untrue. You have asked me to come here. You have, the committee hasn't, but you have just suggested that it is unacceptable that I come here with a plan that is still in development. Deputy, I imagine the Labour Party hasn't finalised its alternative budget yet. It is not outrageous of you not to be able to present that plan, because you and your colleagues are still working on that plan.
Budget's in 6 weeks, 6, 7 weeks. The pandemic's happening now. You've been mentioning this roadmap now for weeks, where the schools are back today. I'm sorry, I'm not here just to make a scene. I'm genuinely worried and perplexed as to why we don't have more detail on this. It's genuine. I'm not this is not for show here, Minister. Okay. Okay.
Well, can I try and answer then? Let me absolutely take you in good faith, Deputy. The schools are opening this week. It's really positive news. And there is a very detailed plan for the reopening of schools, and an enormous amount of work has gone on. And I'm sure you would agree with me on that. The winter plan is happening months before it has happened in any other year. I would love to be able to give you the finalised plan today. What we are doing is accelerating it by several months. It will be more comprehensive than anything that has ever been deployed in Ireland before. We have to get it right. And as I'm sure you'll appreciate, it has to be fully costed, because I need to come to the Oireachtas for the money for that. So in terms of what we're looking at from now until Christmas, there will be detail, Deputy. I'm sure you appreciate that as you and your colleagues in your party, we have to put that detail together and test it. When it is, I don't believe it's a lack of leadership to come to the Oireachtas, Deputy. I believe it is the role of the Oireachtas to interrogate government, and I very much look forward to the debate with you and with colleagues in the Oireachtas on that.
Thanks, Deputy Smith, and thank you, Minister. The next speaker is from the Social Democrats, Deputy Shortall.
Thanks, and you're welcome, Minister, to the committee. Earlier on, I heard you saying, I think I heard you saying anyway, in response to another member, that you were rolling out randomised tests at airports. Is that right?
That's right, Deputy, yeah.
Can you tell us, Minister, what is the point in randomised tests at airports? I mean, it's not as if this is drink driving that we're talking about, where you have randomised tests as a deterrent, because people are hiding the fact that they were drink driving. Why would you have randomised tests for COVID at airports?
Deputy, the purpose of randomised testing is to be part of a full suite of measures which are at the airports. Essentially, what we want to do is we want to discourage non-essential foreign travel. And for those who do need to travel, and for those who arrive here, we want to make sure that there are as many security or biosecurity measures in place as is possible. Randomised testing is one part of a suite of measures to that end.
Are you aware of randomised testing being done anywhere else?
I'll get a briefing note on it, but yes, I believe there are other countries which are doing randomised testing.
I mean, it seems to be a very strange approach to discouraging travel. Why would you not tighten up on flights coming in here, or have stricter rules or enforce the rules, which hasn't been done over recent months? I mean, it defies logic, in my view, that you would have randomised COVID testing at airports. Like, what kind of percentage are you talking about in terms of the random testing?
I think, Deputy, to your broad point on foreign travel and discouraging non-essential foreign travel, which is exactly what we are doing, we need to bear in mind that 97 to 98% of the cases in the country are not coming from abroad.
With respect, I know that. I'm just asking you, if you're going to roll out this thing, which presumably will cost a fair deal of money, what exactly is the point in it, and what kind of percentage of people would you expect to randomly test?
Thank you, Deputy. The randomised testing is being rolled out as part of a suite of measures. So the objective is not that 30, 40, 50%. It's not a mass testing measure. It's part of one of the measures that we're bringing in.
So what's the
e-locator passenger form has been launched this week.
Randomised testing.
I beg your pardon?
What's the purpose of randomised testing at the airports as opposed to, say, in Grafton Street?
The purpose of randomised testing at airports is to provide an extra security measure in terms of testing and tracing for people coming into the country.
Okay, I don't understand that. Maybe you send me a note on it, Minister.
Sure.
It doesn't seem to make sense. I also struggle to figure out what exactly is happening in relation to testing and tracing. I raised this with Paul Reid this morning, asked him why we weren't using the 100,000 tests per week capacity that is there at the moment. He told me that NEFIT determine the testing that is done. I asked NEFIT, and they said that it is important that the testing capacity is protected and ready to go when it's needed. Now, do you understand what that means, Minister? And I would suggest that that testing capacity is absolutely needed now. And all you have to do is to look at the outbreak in Care, for example, where there were 22 cases in a meat factory and 16 other associated cases. Why were we not using that spare capacity to actually test in the high-risk settings?
Thank you, Deputy. To your question, yes, I can answer the question regarding 100,000 tests. The recommendation from NEFIT was not that we should be doing 100,000 tests every week.
No, I know.
The recommendation from NEFIT was that we have the capacity to do 100,000 tests if that's required. I think, Deputy, last week there were over 57,000 tests, and I think what's happening right now is the exact answer to the question you ask. So we had a much lower level of testing about 2 months ago when we were down to about 20 positive tests a day. There was a big programme of work, as you know, weekly serial testing for nursing homes, which was very useful but provided a very low positivity rate of, I think, 0.13%.
But yet,
so what's happened in the recent weeks is we had an outbreak in Kildare, and it was right and proper that serial testing for meat processing plants was rolled out. It was right and proper that serial testing for direct provision was rolled out. And it was right and proper that serial testing for nursing homes was rolled out. On top of that, Deputy, we have a very serious capacity requirement for the schools, and we have a higher level of community testing. That brought us up to 57,000. And so what NEFIT are saying, and I heard the interactions earlier on with you, is we must have the spare capacity in the system so that we can implement measures exactly like this in response to outbreaks and our evolving knowledge of the virus.
But Minister, sorry, just answer this question. Why do we have to protect spare capacity? If there is capacity for 100,000 tests a week, the only reason you would have to protect it is if there's an issue about funding or an issue about reagent, for example. So why would you not use it now when it's needed?
Deputy, we are using it now. It is needed now. Last week we did 57,000 tests. Last week, I think last Friday, was the highest number of tests in any day since this virus arrived. So the HSE acted on NEFIT's advice. They moved heaven and earth to make sure we could scale up rapidly to 100,000 tests, and we are now scaling in that direction, last week hitting 57,000. So what we are seeing right now is a vindication of NEFIT's advice and a vindication of the HSE having that capacity ready to deploy as we need it.
Minister, I disagree. You have the capacity there. Paul Reid confirmed that. There's a need for that capacity to be used now because we know there are high-risk settings, and Care is an example of that. So what does it mean that you have to protect that capacity? Is that a question of inadequate funding, or is it inadequate supplies of reagent, for example? Why are we talking about protecting something when that capacity desperately needs to be used?
Thank you. Minister, do you have a brief reply?
Yeah, thank you very much, Chair. Deputy, it sounds like you're getting hung up on a word that somebody else used. What I can tell you is that NEF said we need 100,000 testing capacity. We have had serious outbreaks. Okay. We are at a tipping point, and we are rapidly scaling up and beginning to use a lot of that 100,000 testing capacity.
Thank you.
It seems to me that the system is doing exactly what it was meant to do.
Thank you, Minister. Thank you. The next speaker is Deputy Kenny.
Thank you, Chair. Minister, I have a number of questions. The first question is in relation to nursing homes and what has happened in the past 6 months. And there's 5 separate inquiries at the moment in regards to what happened in nursing homes. And it really reads for extremely grim reading in what has happened in nursing homes. 971 deaths. 56 of all deaths were associated with nursing home clusters. Of 5,608 confirmed cases of Covid-19 in nursing homes, only 422 were hospitalised. So it really reads for really grim reading. Minister, will you commit to a public inquiry into essentially the catastrophe that has happened to the nursing homes, because it's owed to not only the people that have died in the nursing homes, but also their relatives?
Thank you, Deputy Kenny. Deputy, we may well end up at an inquiry, a public inquiry into what happened in nursing homes, and I know you and many other deputies have been advocating very strongly. The loss of life is heartbreaking, and relatives are very understandably asking, was all that could be done done? We have to look at that now, not with the benefit of hindsight, but with the benefit of understanding that what was done happened in a crisis the likes of which hadn't been seen before. I'm aware, as you are, of some very serious incidences in individual nursing homes, both in terms of individual residents and indeed of very high mortality levels in particular homes. And as you say, the various agencies of the state have been looking very closely at this. HICWA produced a report, which I'm sure you've seen, which looked at the half of the nursing homes that didn't have COVID outbreaks and how prepared they were. I responded to HICWA and asked them to do the same report for the other 50%. Most importantly, I think we got the nursing home expert group report with 86 recommendations. So, Deputy, can I say, and maybe you agree, I hope you agree, that the priority, the number one priority for us all right now is making sure that everything that can be done to protect nursing homes, to protect the residents, to protect the staff, is done. And the focus right now is on what have we learnt, what has worked well here, what has not worked well here, what has worked well in other countries. Are we doing everything we can to protect people most vulnerable to this awful virus? At the same time, to your question, it is absolutely proper and essential that the families of the residents who have passed away or indeed become very sick get full transparency as to what happened. I don't believe that right now is the time to start a public inquiry because we're focusing on keeping people safe. However, I am most definitely open to the idea. I want to see what happens over the next while, work with Nursing Homes Ireland, work with the expert group, work with the implementation committee, focus on keeping people safe and saving lives, and then see what the most appropriate way for families to get answers to their very reasonable and pressing questions is.
Okay, Minister, but will you commit to a public inquiry in your tenure as Minister of Health? Because all the evidence points that we need a public inquiry in relation to what's had to happen in nursing homes. So all the evidence says that we need a public inquiry for each one of them deaths on what reason that there was such a catastrophe. Because behind all them stats where I've said is, you know, a grandmother, a granddad, father, mother, you know, And you know, it reads for really grim reading, and it warrants a public inquiry at this moment of time.
Thank you, Deputy, and I absolutely share your concern and heartbreak about what happened. What I will commit to, Deputy, is that the right approach is taken to answering the questions that need to be answered for the families. So, in cervical check, for example, the right answer was deemed not to be a public inquiry, but by the most excellent work that Dr. Scally did. That led to an awful lot of recommendations which are being implemented, and indeed to the setting up of the tribunal, which is happening in the next few weeks. So can I say to you, it's a discussion for the Oireachtas, it's a discussion for government to see what the most appropriate mechanism is. In the other, well, there are many very sensitive ones, but one that you and I were very involved in cervical check, I think we would all agree that the work that Gabriel Scally did was the right approach in that instance. So we need to consider what the best approach is for the families of the people who have passed away, to make sure, first of all, that their voices are heard, secondly, that they get the answers and they get transparency, and thirdly, that it is done in a timely way that does not kick on for years and years.
Minister, just one final question. Your former Health Minister last March said there was no room for private healthcare in the pandemic. But just, I was contacted by a person yesterday, and in order for them to get a COVID test, it would take 24 hours for an appointment and 48 hours for a result in the public health service. So that's 3.5 days, I think. But if they pay €250 to the Beacon Clinic, they would get that result in 12 hours. Now, how does that kind of match up when we've just spent €350 million to private healthcare in relation to the pandemic?
Thanks, Deputy. The median time in the public system from a swab to a lab result is 30 hours. It's 1.2 days. The additional time, I don't have the details, obviously, but I'm more than happy to look at them. But when people talk about median times of approximately 3 days, it includes several days of contact tracing that happens afterwards. But the median time at the moment for the HSE from a swab to a test result is 30 hours.
Thank you, Deputy Kenny. Thank you. The next speaker is from the regional group, Deputy Shannon.
Thanks, Chair. And Minister, I don't think I got an opportunity as yet to congratulate you on your elevation, and I'm just wondering, the grass may be greener. I imagine it's just as difficult to cut on the other side too. I want to bring up something here that is within the remit of the COVID committee because it relates to hospital inpatient stays, elective days and hospital capacity, and that's the issue of the second cath lab at University Hospital Waterford. We now have 7 cardiologists in that centre trying to access all of their patient schedules through a single cath lab. You're aware it is in the programme for government. I know government has given a commitment to build a project, but I'd highlight to you that a tender is being issued in September, and it's going to take 4 months to evaluate who it should be awarded to, and it requires an Office of Government Procurement review. Will you give a commitment here today, Minister, to short-circuit that process, please? There is no need whatsoever for that to take 4 months. This project is now heading for 2 years, and we have yet to award a grant of tender build.
Thank you, Deputy, and can I acknowledge the ongoing work you did before you were a member of the Oireachtas and now. Deputy, I think you and I, to be fair, both know that your question is not within the remit of the country's response to COVID-19. Nonetheless, I know it's something that is very important to you, to the TDs in the Waterford area, and most importantly to the people in Waterford and that region. The programme for government gives very specific commitments on this, and I think it's something that you and Minister Butler and Deputy Cullinan and the other deputies and public representatives in Waterford deserve great credit for, because you fought a very hard fight for that, and as we both know, there has been some very significant pushback. The second cath lab being put in place is a massive win. The time it takes to put in is based on the appropriate guidelines. I am more than happy, Deputy, to ask for a report and see if that can be accelerated, because I am all too familiar with how important having that facility up and running is to the people that you represent.
and to the patients as well, Minister, most importantly. So thank you for that. If I just move on there, you and I both discussed the Type A contracts that were looked to be offered at the time of the private hospitals deal, and I heard you reference earlier that the funding is being put aside to try and look at additional capacity. Will you, if contracts have been written with the private hospitals, will you again be looking for private fee-paying consultants to either be included, or will they be excluded from providing a service in that arrangement?
Deputy, can I just clarify, is your question with regard to a future contract with the private hospitals in the context of COVID for the coming months?
Correct, yes, yeah.
Yeah, so all options are on the table. Tenders have been put out to all private hospitals. It's not being done in a coordinated way by the association this time. Tenders have been put out for services, for beds and for surge capacity. They're being negotiated hospital by the HSE, and it is entirely possible that as well as procuring beds, as well as procuring diagnostics, that we would indeed be procuring on a procedure basis, just like the NTPF does right now, which obviously would involve the people currently working in those private institutions.
Well, I think that would represent the best value for money. Just on another point, in terms of the lack of consultants in the country, you'll be aware there's a large number of largely, I suppose, foreign doctors who have been residing in Ireland for many years at registrar position. And is there any opportunity now to look at either additional training or trying to fast track some of these doctors? They absolutely have the experience. It would appear that they're, for other reasons, not being appointed to consultant positions. I think that's something that you should look at. You don't need to give me an answer on it. I'm just saying I think it's something that you need to look at. Also, with respect to the National Ambulance Service, and we're talking now about the issues of COVID and the deferment of elective patient procedures, etc. But there's been significant issues with the National Ambulance Service in terms of resourcing. As you know, there was tendering for new ambulances and additional capacity. Again, I think that's something that you need to look at long and hard before the winter comes in. And could I just, because my time is up, could I also, I'm going to send you on a document which I imagine has been sent to many TDs and Shannon members, and it's in relation to a submission which is backed by Professor Michael Levitt, a Nobel laureate from Stanford University. And I think it would be worth discussing it with NEF. It obviously challenges some of the perceived wisdom and thinking that is pertaining at the moment, and I think it would be important that it certainly gets looked at by other outside health experts to make sure that we all agree we are following the best path. Okay, thank you.
Thank you, Deputy.
Thank you very much. The next speaker is from Fianna Fáil, Deputy Sullivan. No, it's okay because there was no second Fianna Fáil speaker. And then Deputy McGrath.
Thanks, Chair.
You've up to 10 minutes.
Five should be sufficient, yeah. Thanks, Chair, and I'd just like to welcome the Minister here today to answer questions before us. Minister, just a number of queries here. I'll keep it brief. I'd be interested in hearing the answers. Just the first one that we came across recently is the omission of the post offices, credit unions and banks from regulations on face coverings. I'm assuming that that's related to security concerns at those facilities. I was just wondering, could you provide any clarity in relation to that? Secondly, there's an issue with over 70s. I suppose the recent guidelines have impacted on those people most. They're restricting their movements and, I suppose, returning to some degree of cocooning. Just in relation to that, could you provide people in that age bracket with some kind of practical advice of what's expected of them, you know, how they should go about their business or restrict their business, their daily business to I suppose, ensure that they're adequately socially distant and so on. I would be interested in hearing how you might provide some practical examples of that. And obviously, in relation to that, many elderly people in particular would be obviously at present have appointments with the National Treatment Purchase Fund, and many of those appointments would be taking place obviously up the north. And I suppose in an era where or in a time when we're asking people of that age group to be socially distant and cocoon, I suppose, has the advice changed or deviated on those people that might have those types of appointments in the coming weeks ahead while those impositions are still in place? And my final question then just relates to meat plants. At present, the majority of testing seems to be pre-announced testing of employees at those plants, and as opposed to random testing of employees. And I was just wondering what the rationale was behind that, or could you explain the distinction? Thanks.
Thank you very much, Deputy. The short answer on face coverings in financial institutions is yes, for the reasons that you outlined. For the over 70s, yeah, the advice, let me try and, as I'm sure you can appreciate, you want to be careful about sounding like you are the Chief Medical Officer and providing direct public health advice. So let me do my best to paraphrase the advice from the Chief Medical Officer. Essentially, it is to use extreme caution right now. We know from the data that people who are more vulnerable to this virus, be they over 70 or with underlying conditions, are being extremely careful. We know that because as the number of cases has gone up and up, thankfully the number of fatalities, hospital admissions and ICU admissions has remained stable and very low. So we know that people who are more vulnerable to this disease are already exercising their judgment very well and very effectively. The message during this period, which hopefully is just the 3.5-week period, is to be even more careful. What does that mean? It means limiting your number of social interactions, limit the number of people who come into your home. If you're going shopping, please do it during designated times for more vulnerable people if that's available. If not, see if there are other ways of having shopping brought to your house. People have asked me, can they still go on their holidays in Ireland? The answer is absolutely yes, but take all of the precautions you would be taking at home. Limit your social interactions, wear face coverings, ask other people to wear face coverings, and so on and so forth. Can I make a point on this as well, Deputy, if I may, which is it's not just up to people who are more vulnerable, it's up to everybody else as well. So we all have a role to play, and the Chief Medical Officer spoke passionately and strongly this morning about the need for solidarity. The best way that people who are vulnerable to this disease can be protected is for us to suppress the disease in our community. That means keeping our distance, limiting the number of people we meet with, washing our hands, wearing face coverings, and the other measures. So that really is the message that I want to get out, that I hope everyone in this committee gets out, which is we have to do this together, we can do it together, we know that it works. Can people still go to Northern Ireland for health appointments? Yes, absolutely they can. And I'm sorry, Deputy, you had a final question around cereal testing and meat processing plants.
Yeah, I suppose at present many of those tests seem to be pre-arranged or pre-announced as opposed to random testing. Is there going to be a change in that, or is that going to continue to be the practice?
So there's two different things. There's randomised inspections, which the HSA have now stepped up, which is right and proper. In terms of the testing, it is serial testing and mass testing. So it's important that when the National Ambulance Service is coming to a plant that they can test everybody, they can do it quickly, and that does mean giving people notice. But there's no concern has ever been raised about giving people notice for testing. The concern raised was that inspections need to be more randomised, and that is beginning to happen.
Yeah, sorry, that's what I meant, randomised inspections. So,
yeah, yes, so that is happening more now.
Okay, thanks.
Much more, because it was conspicuous. Just as a quick follow-up question, much more because it was a little bit, the imbalance between how meat plants were treated and practically every other sector of the economy was striking.
Yeah, agreed. Agreed. I'm just looking for the figure, Chair, but from memory, I'll get you the exact figure, but I believe I read one this morning that something like 22 of the last 27 inspections by the HSA had been unannounced, but I'll get you a full briefing on that.
Okay, thanks very much. Thank you. The next speaker is Deputy Matty McGrath.
Yes, Minister, if I could come in on that point, actually, Minister, you quoted at a press conference recently that in one weekend, 6,000 pubs were inspected and visited, and you found that 26 of them were non-compliant. And you compare that then with the meat plants. Indeed, I have one in my own town of Cahir. Only 39 inspections were carried out in meat plants, and a total of 39, and 30 of those were pre-announced. You could visit 6,000 pubs in a weekend, and you can only do 39 meat plants and 30 of them are pre-announced. Those figures are stark. They are your own figures that you quoted. And those figures in the pubs were over one weekend. And the Gardaí have enough to do without visiting those. You know, what have you got against the pubs? What have you got against them? Because they haven't been found guilty of anything, but they have been blackguarded and they have been destroyed. Also the Rinca Scholar, the dance schools, the musicians and the artists, they're really being left behind here and being crushed and left behind. There's a whole cohort in, Minister, I want to ask you to reply to as well, is about people with disabilities, especially anyone on the autism spectrum or any of those, you know, special needs children. They have really, really suffered, and they're not fully back up and running yet, and huge attention must be given to them. It's a huge challenge and very, very challenging, and they must be supported, as I said, because they need that. Minister, we also had a situation in Golden with Welsh mushrooms. Why wasn't this testing done? Is it not done in the plant when there's ample space, rather than going into the middle of a village, you know, and frightening people, you know, set up a camp there? And I salute everybody that did it. I salute the community for their engagement. And there's a further testing next Saturday, which should be done on the plant. There's plenty of space there, away from the local village, and just kind of putting fear into people, you know, when they see the army arriving in and the Gardaí and everybody else, the whole entourage. So as I said, the inspections are pretty stark. And as I said, the whole situation regarding the treatment of the publicans that are open, and letting you call them what you like restaurants today. There are pubs, many that do food, more you are forced to do food, because apparently the €9 worth of food is better than any antidote or any you know, the thing that you're trying to set up, that you're trying to cure, you're trying to get. So the food is the cure. That's what you're giving out, those mixed messages. And they're very wrong and very damaging. And I would put it to you, Minister, that yourself and the President Taoiseach have dropped the ball here since you took over. And I wished you well when you took over. You dropped the ball and you've lost the public confidence. And some of that was your own response in press conference, where you equated the virus with children being on a trampoline, us driving a car. They're pretty silly things to say, or else the virus isn't that serious. So one or the other, please, could you explain?
Thank you for that, Deputy. Chair, if I just might, I have the figures here regarding the HSA. So there were 23 meat plant inspections in August so far, and 22 of the 23 were unannounced. I just want to note that the Health and Safety Authority does not fall under the remit of the Department of Health, but obviously we're working very closely with them.
The last fortnight, because that's a big jump up from the figures that we were given by the HSA here 2 weeks ago.
Yes, agreed. Deputy McGrath, do we need more HSA inspections? That is a question directly for Minister Varadkar, but I can give you my opinion as Minister for Health. As we look at the meat processing plants and other high-risk areas, I want to see as many inspections as possible to make sure that the high-risk workplaces in particular are compliant with the protocols that have been put in place. And my preference is for unannounced inspections for obvious reasons. You asked why the pubs were closed. Deputy, can I say I share your frustration? It's not fair. It is not fair for publicans around the country. I know that. The reality is we are dealing with a virus that is close to us having to lock down the country again. The public health advice is that we are at a tipping point, and we are doing everything we can to suppress this virus, to stop a second lockdown, to get the schools open, which we now have, to keep the businesses open, to protect jobs, to get the hospitals open, and so forth. And the public health advice and evidence is that in other countries, unfortunately, where the pubs have opened, they have been associated very quickly with outbreaks, and that's the reason. I really don't want to be here saying that. I would like nothing more than to be announcing, and hopefully I will be as soon as possible, announcing they have to be reopened. The same applies, unfortunately, to dance schools. It's not about going after anybody, it's about trying to save lives. And the measures that the government has brought in for this 3.5-week period are based on the evidence that the National Public Health Emergency Team has for where and how this virus spreads. And what they found is that large indoor gatherings are one of the areas where this virus spreads, unfortunately. But in being able to target that, what we're able to avoid is much wider shutdowns, because our experts know more about the virus than they knew 4 or 5 months ago. I fully agree with you, Deputy, on disability services. It is an absolute priority. With regard to Golden, might I respectfully push back, Deputy, because you've made some comments about why was it set up here, and people are intimidated by the guards coming in, the National Ambulance Service coming in. Could I respectfully just push back on that, Deputy? What happened was an outbreak was detected very, very quickly, and the healthcare services of the state were deployed in Tipperary almost instantly. All workers were sent home, all workers were isolated, all workers were tested, and because of that ability to move quickly and comprehensively, we have the best chance of stopping the virus spreading out into the community in Tipperary. So I understand your questions, and I know you are giving voice to the frustrations of the people you represent. But on this particular issue, can I just remind you that what happened in Tipperary was exactly what we have to see to suppress this virus, which is the public health services working quickly and comprehensively to deal with the clusters as they emerge.
But just briefly, 10 miles away then in Care, the factory wasn't closed. The test was done by a private company behind closed doors. You know, I wanted to know why it wasn't tested on site, which there was space in the mushroom plant, I know, plenty of space. And then why the difference between what happened in Golden and what happened 10 miles away. The HSE did an excellent job, and the Gardaí and everybody in Golden with the locals, and I compliment the local community. A whole different story in Care.
Minister.
Thanks, Deputy. I can't speak to any individual company that hires a private company for testing. I can't speak to that.
The next speaker is from Sinn Féin, Deputy O'Reilly. Are you taking 10 minutes?
I am, Chair. Thanks.
I'm not sure where I am on the speaking list. I just want to.
Well, sorry, well, I tell you, it's Sinn Féin. The order for was Sinn Féin.
There's a different order outside.
Sinn Féin, Fine Gael, Fianna Fáil. So it would be Deputy O'Reilly, followed by your good self, followed by Deputy
Thank you.
McCall.
I just want to check that.
Yeah,
thank you.
thanks.
That's great.
Go ahead.
Thanks very much, Chair. And thank you, Minister. And thanks for coming in. Thanks for answering questions. I have to say I wasn't especially impressed with the submission, given that it did take quite a long time for us to get it. I understand there was an issue in the Department of Health yesterday. But just for, I suppose, for future reference, we would probably expect something a little bit more substantial, given that that there was a lot of delay. Minister, can I ask you in relation to the rollout of the flu vaccine for under 12s in particular? I understand that GPs were sent an announcement from the company Sanofi that there's been a delay in the procurement. So what impact is that going to have on the delivery and the rollout of that scheme? So we know there's going to be a delay because there's a delay in the vaccine getting here to be distributed. So what is that delay going to be in terms of weeks, please?
Thank you, Deputy. With regards to a detailed submission, I was asked to make a 5-minute opening statement. As you know, there was a very serious incident at the department yesterday, but any information, Chair, that the committee wants, obviously we will get it. But what I submitted was the opening statement, which is the normal protocol in this case. But Deputy O'Reilly,
just about the flu vaccine.
If there's any information you need, please let me know.
I will.
I will ask for a report specifically on how many weeks or how many days, indeed, any delay will be. However, I can give you a decent answer on the flu vaccine and what's coming if you like. We've got 1.3 million doses on order. It's sufficient for a 90% uptake amongst the at-risk groups and healthcare workers, all of which is going to be provided for free. To the specific version you referenced, Deputy, we've 600,000 doses of the live attenuated influenza vaccine, which, as you say, is being delivered via nasal drops rather than injection. That's going to cover 75% of 2 to 12-year-olds. We're targeting the groups, obviously, most likely to be hospitalised by the flu.
Okay, but you don't know as yet what impact this delay is going to have. And you said days, I'm saying weeks because the delay is weeks, so the impact is going to be weeks. So by my guess, you're not going to start the first series of these vaccines until, or the nasal delivery until October. Would that be about right, do you think?
That's certainly not the plan, Deputy, no. The plan is to administer this as quickly as possible. The original plan is September. I'll get a detailed note as to what delays may be occurring, but the plan, as I understand it, is September. Are you
aware of the delay from the company Sanofi?
No, I'm not aware of any delay.
Okay, so that was sent to every GP in the state and ministered, and that is going to have an impact, and the impact, in my estimation, is going to be weeks. Anyway, but I will appreciate a detailed note on that. Can I ask, with regard to contact tracing, so we were advised this morning that there are 100 people today. You said there's going to be 150 people working full-time on contact tracing by the end of the week. Where are these people coming from? Are they people who are being redeployed from other areas in the health service, or are they contracted just to do the work of contact tracing?
They're being redeployed from various parts of the public sector, Deputy, including departments, civil servants, the Army and other places as well.
Okay, and are some of them redeployed healthcare workers?
To the best of my knowledge, no. None of them will be redeployed.
And none of the 50
workers
that are going to come in the next couple of days are going to be healthcare workers?
Sorry, say that again, Deputy.
There's 50 to be recruited or appointed or begin work in the next 2 days, according to yourself, because it's 100 today. You're saying it's 150 by Friday. So the 50 extra are not coming from the health service?
No, they're coming largely from the civil service. Okay,
that's excellent. So with regard to the numbers on trolleys today, so this is just a series of questions on capacity, if I could. So there's 130 people on trolleys. You know, I'm assuming that you will, as you did until very recently, accept the INMO figures on this, and we won't have the usual ding-dong about we count them this way, they count them that way. There's 130 people according to the INMO, and that's usually good enough for most people. Can I ask, with 40% reduced capacity due to COVID-19 measures, have there been any modular builds specifically to cope with COVID? And can you just say where they are and what the capacity that they will add will be? And I say specifically to do with COVID because obviously you and I would have taken issue with the previous minister re-announcing stuff constantly that had already been announced. So I'm aware of projects that were announced pre-COVID. You're aware of those as well. So are there any that are specifically related to COVID that will, in terms of modular capacity, and how many extra beds are they going to add into the system?
Thank you, Deputy. Yes, as with you, I am acutely aware of the number of people on the trolleys. As with you, I do accept the INMO figures. I appreciate that the HSE uses a different way, but you and I have used the INMO figures for a long time. With regard to the reduced capacity, can I say it's not 40%? So the reduced capacity, and Deputy Cullinan and I were having this conversation earlier on, the reduced capacity in terms of acute beds is reducing all the time. The figure we were given initially was 20%. That figure has now gone down quite a lot thanks to the work of the HSE, individual hospitals working with the HPSC on that. It is closer to 40%, as you say, for some issues like complex diagnostics and some more complex surgeries. But in most cases across the system, we expect the reduced capacity to be significantly less than 40%. And some of the things we're doing to deal with that are extending the telemedicine for outpatient consultations and so forth. The specific numbers in terms of acute beds, additional acute beds, not pre-announced acute beds so far this year, is 400 acute hospital beds and 700 intermediate care beds. As you're aware, Deputy, they have been brought on board from a wide variety of places. Some of it is opening closed capacity within full-time settings. Other of it has been brought on board, for example, through the convention centre and other temporary places. The HSC is engaged very closely with the department right now.
Sorry, Minister.
I just finish this, Deputy, for you, if I can. In putting together a very detailed winter plan. It includes consideration of exactly the questions you've asked and how we turn the temporary additional beds into at least intermediate, medium-term and ideally long-term beds.
Okay, so the only modular capacity that you've referenced there is in the convention centre, so that's in UL, is that right?
I beg your pardon, Deputy, say that again.
The convention centre in University of Limerick.
I'm sorry, I can't
The convention centre.
What about the convention centre?
That you just mentioned.
Centre in the University of Limerick.
Yeah.
Oh, sorry.
That was UL that you were talking about there. That's why I wanted to stop you.
Yeah, look, yes, but there's...
Okay, so apart from that, sorry, just let me get my question. Apart from that, there's no additional modular buildings being added. So the capacity, when it comes, will come from closed beds already in the system. There's no new modular capacity going to be put into the system. Is that right?
There very well may be, Deputy, yes. So, for example, we have 29 additional community assessment hubs. They can be looked at. We have the 700 intermediate care beds, the 400 additional acute hospital beds. What I want to see is funding and resources to keep all of the beds that have been opened, to have them remain open. But obviously you'll understand some of the additional beds, like the intermediate care beds, have been opened in the community settings, which obviously are not long term. But part of the winter planning process is to look at exactly that question in terms of additional modular capacity that can be brought on very, very quickly.
Okay, so there's no modular capacity at the moment, and you don't know where it's going to come, only that it might. Can I ask how many beds are currently closed because of staffing issues, because you can't staff them?
The hospitals are currently working at 96% capacity, so off a base of, I think, 11,000 beds, inpatient beds, we're at 96% capacity. There is no breakdown, Deputy, of exactly which beds are closed because of staff shortages, infection prevention and control measures. As I'm sure you'll appreciate, the hospitals are balancing an awful lot of different factors right now, including staffing, safe staffing, new protocols for staffing, infection prevention and control, but we're at 96% occupancy. The remaining 4% is for a variety of reasons.
Okay, so with regard to the safe staffing model as agreed with the INMO, whereabouts is that at the moment? Is that in place? Is that in place everywhere? Is it in place in some places? Do you have a percentage figure for me? And we're running out of time here, if you could.
The safe staffing levels that you and I both advocated very strongly for last year have not happened, unfortunately. What I found out was that whilst progress was being made, that progress was essentially stopped dead because of COVID. We are working with the INMO, and the INMO and I have met and discussed this. We continue to work it through with them to get to safe staffing for nurses and midwives around the country. It is a top priority for government.
And can you give a figure on how many consultants you expect to recruit before the end of the year?
I can tell you that there are 500 vacant consultant posts.
Vacancies, but how many are you expecting to fill?
I don't think anyone can answer that question right now. I'd like to fill all 500, and there are a variety of things that we're doing to that end. So we've agreed some of the C contracts. We're moving quickly on the new Sláinte Care contract, which essentially is like a contract, so we're looking to do that in the current Dáil term, and we will be looking at ways to address the new entrant pay inequality issues, which you and I have discussed many times before.
And just very briefly, well, I'll conclude on this. We know that about up to 600,000 people have deleted the app off of their phone. Minister, is there any confidence-building measures in play that's going to encourage people to download the app again? Because I'm sure you're concerned about that figure. I'd be very surprised if you weren't. It's in the paper today. Up to 600,000 people have deleted the app from their phone, so it's going backwards instead of forwards. So the figure of 1.7 million that I'd heard, obviously that's now not correct. Have you plans to put anything in place to ensure that people will have their confidence restored in the app, and that the uptake will start going in the right direction as opposed to backwards, which is where it's going now?
Thank you, Deputy. So currently we're at about a 35% penetration of the app. The international evidence suggests that we needed 25% for it to be effective. So we are well ahead of that, and I want to thank everybody for that. Could I just urge a word of caution, Deputy, when you state that people have lost confidence? Let's be very careful with what we're saying on this. This is a very, very important weapon in our arsenal against this awful virus. It is being used. It is being effective. I don't believe there has been a loss of confidence in the app whatsoever. It's working very well.
You have to have an alternative explanation for why people are deleting it off of their phones. I mean, a loss of confidence would be the obvious one to me. If there's another reason, you could share it. But I have the app on my phone. I have done as much as anyone to promote it. But if people are deleting it, they're not deleting it for any reason other than they've lost confidence in it, let's be honest.
Well, Deputy, I would just say neither you nor I know that. So given that we're the roles we're in, let's not just be jumping to those conclusions whatsoever. The app works. It was rolled out very, very successfully. It is providing valuable information to the contact tracers. It is saving lives. Everybody who has it on their phone is doing their part.
Thank you. The next speaker is from Fine Gael, Deputy...
Talking about the Norman T.
Sorry?
Talking about... Sorry, I'm going to can't just squaling.
Yeah,
talking about the Norman T.
I'd
like to welcome the Minister, and I appreciate that he's got a particularly good grasp of the answers I've been listening to today. And I just want to concentrate, you would have heard me on these issues before, because most of people who have died or been seriously ill as a result of the coronavirus are actually older people or people with immune systems which are suppressed or impacted on. Are you satisfied, and what additional steps are you taking to ensure that nursing homes, be they public or private, are ready for the winter, and obviously particularly for influenza and COVID should it unfortunately come?
Thank you very much, Deputy. I think that's one of the most important questions any of us can ask right now, and I want to acknowledge that in my time on the COVID committee that you have been a tireless advocate on exactly this question and making sure these measures are in place. Yes is the short answer. So we have a very useful report from HICWA. It looked at the half of nursing homes that didn't have COVID outbreaks and assessed them across a wide variety of measures in terms of their preparedness for a second wave. I have written to HICWA and asked them to do the same for the other half, obviously. We had a very, very comprehensive report from the expert nursing home group. They have 86 recommendations across 15 themes. We launched it last week. We have set up an implementation team, including the stakeholders that need to be involved. They also have expert advice from people who were involved in writing the original report. They will be coming back to me very soon in terms of the additional measures that need to be put in place. My goal and government's goal is to make sure that everything that can be done is done for all nursing homes. I have to say, I believe the nursing home recommendations were superb. There were some very short-term ones. In fact, some of them we already have in place. There were medium-term ones. They also took a look at the much broader questions around is regulation of older care in this country good enough? It's a point you've raised repeatedly yourself. The answer, of course, is no, it's not. So they have also given us direction in terms of the work that we have to do in this government to improve elder care, be it in nursing homes or in hospitals or of course at home. And we've seen some very striking figures for other countries, particularly in Scandinavia, in terms of the percentage of people who can live in their older years at home as opposed to going into nursing homes if they have the supports at home, which they should have, and which we want to take a very close look at making sure happens.
I welcome your comments on that, and I would hope that with your department and with the Oireachtas administration we would have a full debate on them perhaps next week or when we come back. Just to take you up on that point, it's a commitment in the programme for government that there will be a statutory home care package introduced as quickly as possible. And can you tell me what progress has been made on that? I think I have spoken to a number of people who have either in nursing homes or the families have family members in nursing homes. A lot of them would love to live at home if they could, but in fact in the past, notwithstanding the increase in hours which you spoke about, the facilities haven't been there for them. So I know as we move into winter there will be an increasing demand for home care hours. So are you satisfied that across all of the CHO areas that there will be adequate home care, both in terms of the hours available and the qualified persons to provide that to those people?
Thank you, Deputy. So, as part of the COVID measures that have already been taken, 2.6 million home care hours, additional home care hours were allocated, and that's to do exactly as you said. It's to say we've got to do everything we can to keep patients, particularly those more vulnerable to COVID-19, out of the hospitals. As you say, one of the most important ways of doing that is to provide adequate home care hours. So 2.6 million additional home care hours have already been deployed and sanctioned. The winter plan will be looking at a very considerable additional number, and bulking up the multidisciplinary teams required to support people living at home. We have to do everything we can, Deputy, this winter to make it unnecessary for people to go into hospital. So what are we doing? We're providing as much home care as possible. We're also looking at putting in place community hubs so that people with respiratory issues, maybe people who get the flu, can be treated as they need to be treated, but not in the acute setting this winter. To your direct question on the Fair Deal scheme, it's something I absolutely want to see. I think the current situation doesn't make sense, whereby if you're well enough to stay in your home, the state won't provide the supports required. But if you go into a nursing home, the supports will be provided. I think that's backwards healthcare.
Very much.
And I want to work very closely with the Oireachtas and with government to do something about that as quickly as possible.
I tell you what, I'll raise that with you in the Oireachtas by PQ or whatever, but I welcome your comments now. The two issues that upset me most and upset most of my constituents and indeed the whole country, one of them was this morning when we had a wife of a poor man and his son who died in Kilbrew nursing home, and the appalling description of, you know, the maggots on the poor man's face and the way he was being treated cries out for justice. And while I understand you're talking about other inquiries, I think you need to appoint urgently a qualified professional who will look at Kilbrew House, and I know there are other deaths there as well, as a matter of extreme urgency, a qualified person. I know that Des O'Neill did the one on Lee's Cross some years ago, but I think it needs to be done. It is absolutely unacceptable what I understand happened there. And I think part of the inquiry has to be into the correspondence between SAGE, who are representing this family, and HICWA. And I think there are 3, if not 4, notices of concern issued to them directly about this family. And it's just appalling. And the second part of the question, and I asked it this morning of the HSE, the deaths in Dalgan House were the highest of all the deaths in County Louth for a period of 3 months. I think half of them came from Dalgan House. And families are extremely upset. There was a report done by HICWA, but they haven't seen sight of it. And they're not getting answers from the HSE and indeed from the Department of Health. Their view is that there's obfuscation and delays. They've spent hundreds of euros on FOIs to try and get at the truth as to why the Department of Health and HICWA put in the Royal College of Surgeons in there, into that nursing home to run it because of what they found. Now, they've lost their families members. They're in absolute trauma at their deaths. They are absolutely deeply frustrated at the bureaucracy they're meeting. So can I ask you the same question as I asked Mr. Reid this morning? Will you meet with those families, number one, to listen to their issues? And will you appoint a competent and qualified person, especially and specifically, to look at what happened in that home on the particular and special grounds that you put in? I mean, you, the Department of Health and HSE, put in a special team to manage it, because one of the issues that the majority of staff who worked there were unable to be on duty, and patients, you know, they died. And there is evidence that the HSE was aware of the fact that, say, that a very significant number of workers were absent due to illness and other reasons, and that while they gave assurances that we're acting, there was a delay of at least 4 or 5 days, where a lot of people would have caught that COVID as a result. So this is a very serious issue. I'd appreciate your comments on it, please.
Chair, I know I'm out of time, but given the sensitivity, can I take a short bit of time to answer the questions for the Deputy?
Of course, yeah.
Thank you. Deputy,
I'll agree.
Thank you. Deputy, I share your sentiment in terms of what has happened. And can I start by saying, I, along with us all, I want to express my sincere condolences to Mary Bartley Meehan and to her family, to Mr. Meehan's family, during what must be an extremely difficult time. HICWA is investigating what happened. and they are providing a report to me.
That's my whole point.
Can I just say, Deputy, to answer your question, if I believe that the HICWA report does not sufficiently answer the questions that the family have a right to know, then I will act.
I think, Minister, if I can intervene here, HICWA, the regulator, they didn't regulate and they did not act, and they cannot be the decision maker in this. That's why I think you need, and I appreciate with short time, an independent inquiry. I can send evidence to you that may help you make up your mind on that.
Thank you, Deputy, and please feel free to do that. Deputy, what I'm saying is this, is that in the first instance, the only agency of the state that can do this is HICWA. That's the current law. That's the current regulatory environment.
You're the regulator of the Home Minister. They didn't do their job.
No, that's fine, Deputy, but what I'm saying is in the first instance, HICWA have to investigate. And I'm not, and I'm sure you'll appreciate, I'm not going to be making allegations about the inability of HICWA to investigate. They are the state regulator. They're very good at what they do. If I conclude...
Your point could have a conversation over and back. We do need to bring...
Yeah, sorry. I'll just finish on this, Chair. If I conclude that in either case, Kilbrew or Gelgan House, that the very reasonable and real questions of the families have not been answered, then we will take further steps.
Thank you very much, Minister. Thank you, Deputy O'Dowd. The next speaker is Deputy McCall, if you're taking up to 10 minutes.
Yeah, thank you, Chair. Minister, first of all, I appreciate you coming before us. I know when the invitation was issued 14 days ago, it was to do with the increased restrictions in the Kildare, Laois and Offaly area, and I think over the last 14 days, while it's disappointing that Kildare hasn't emerged, I think we have successfully managed the outbreak in those counties, and by allowing the public health experts to take the lead, we have dealt with the virus as best as we could. I think, Minister, over the course of today, I've taken two things away. One, when I hear Paul Reid talk about us living with the virus, and I hear Dr. Ronan Glynn talking about how we can reopen sensibly. We are essentially engaging in a strategy now, not of a zero-risk strategy, but actually the idea that we must allow our economy reopen so that we can go to school, so that we can engage in our health service, and so that we can protect our jobs. But we must do so with the balance always being on the side of public health. If that is the case, I think your analogy of risk management, which there was some discussion about, is actually the correct one. An analogy I had used many times, and I risk using an analogy again, is the idea of the first time you let your child walk to the shop. You never know when it's the right time to do it. Inevitably it involves risk, but you know you need to let that child grow and gain independence. So each time we go out into the world, there is risks, and as we head into a world of living with the virus, that is what we are doing. However, Minister, what we heard today was the idea that while previously activities were judged on whether it was possible to have social distancing and the public health advice, we now seem to be moving into a different area where some activities, even though they are possible to have social distancing, they're not permitted because it involves increased household contact. And can I say, Minister, that I think brings us into a difficult territory where we're making judgments about what is a good activity or a bad activity. It's always a dangerous area for government to be involved in. And if we're going to have this for long periods of time, living with this virus, perhaps we are better guiding people to have a prescribed number of social contacts or a prescribed level of social contact, and to allow them to apply it, whether they want to go to a football match where they can stand 2 metres apart from people, or whether they want to go for a meal in a restaurant where they're only 1 metre. Different people choose different things to do in their life, and I worry that if we're going to stay with this for long periods of time, we may be in a difficulty where the state is dictating what is a desirable activity. I know that's not the intention at the moment, it's as we unravel, but if this is going to be with us for several months, I think we need to give more leniency, and we need to get back to a situation where people can more easily understand what is permitted and what is not.
Thank you very much, Deputy, for that. Can I just say on the issue around comparisons of risk, that during a conversation about getting the schools open, I did make a comment about our need to manage risk. And one of the examples that I used, I believe, did cause a lot of genuine hurt and anxiety and concern. It was in my head, as it happens, because that's how one of my kids broke their arm recently enough. That's why it was in my head, and I wasn't for a moment suggesting that the risks were comparable at all. But I understand that in an environment where people are really very worried, that people were, it did cause anxiety. And I certainly didn't mean to add to anybody's anxiety on that. Can I provide some good news to the point you make on children, Deputy? Which is this: the Royal College of Physicians of Ireland have just released their latest view on the impact of COVID-19 from a health perspective on children. And I'm just going to read you one paragraph, if I may. A quote as follows: "It's clear now that, fortunately, the vast majority of children who get SARS-CoV-2 infection do not develop severe COVID-19 illness. This also appears to be the case for children with underlying health problems. These children may get an infection with very few symptoms at all, or they may experience an illness like, but usually no worse than, the seasonal flu. Children who are immunocompromised or taking immune medications for inflammatory conditions, such as arthritis or inflammatory bowel disease, also do not appear to have an increased risk from COVID-19. So we're all worried. I'm sending my own children back to school tomorrow. But there is good, positive news emerging from the experts on this. To your broader question, Deputy, in terms of, I guess, what's the right balance that we strike in managing the risk in our society? And we are all figuring this out, as every country is as we go. So, as was put to me by medical experts on Kildare, Laois and Offaly, because of early detection, because of what we now know about the virus, we were able to bring in much less restrictive measures than the countrywide lockdown that we saw. The point was made to me by one expert that had that happened 4 months ago, that would have actually spread into the whole country, and we would have had to lock down the whole country. So I think if the first piece of good news is that the medical evidence on children is very reassuring. I think the second piece of good news is we are learning every day about this virus, and we're now at a point where, as proven by the efforts of Laois, Kildare and Offaly and the people living there, targeted localised measures can work. And I guess you're now asking the next question, which is, can we be even more non-specific than that? And actually, maybe we all at this point have internalised, we all know the guidelines, you know, limit our social interactions, wear the face coverings, obey social distancing and all the other measures that we all now know. I think the answer is hopefully in time, yes. And if Chapter 1 was flatten the curve by locking down the country, we're now at the start of Chapter 2, which is suppress the virus in a targeted way so the rest of society and the economy can function. Maybe what you're describing is Chapter 3, that it will become so implicit in how we live and work and interact that will be enough. The expert view from NEFIT is that we are not there at this point, and that right now, based on the increasing number of cases in Ireland, the rate at which they're rising, and the profile of those, that they are in workplaces, they're in homes, they're in social settings, that right now we are very finely balanced in terms of a second wave. And if there is a second wave, the government will have to consider the very blunt instrument which we know works, which is a lockdown. So we're doing everything we can to avoid that. Certainly, the public health advice right now is that targeted measures are needed. And I agree with the spirit of what you're saying, Deputy. We've got to trust people. And people know how to deal with this. In some of the targeted measures, we are specifically targeting areas where maybe the level of compliance isn't what it needs to be, and maybe simply just trusting everybody to do the right thing isn't enough. So, for example, we know that there are a number of house parties, and we know that they have been considerable vectors of this disease.
Thank you, Minister.
I think
I might ask.
Wallace wants to use a minute and a half. There is no more than that, I'm afraid.
Thank you, Minister.
Thanks.
Thanks very much, Chair. Thank you very much, Chair. Thank you very much, Minister, because I know you've been heavily engaged with me and indeed the County of Kildare over the lockdown period, so I appreciate that. Just a very quick question. Please, it's coming to the end of the session on a very short time. What are the? I want to manage expectations here, but Kildare is obviously still in lockdown. If the cases are under control, and I discussed earlier with the CMO and the possibility of the data sets being released, so we get the granular data. And I'm told there will be an update later this week. If the data is looking good, what are the prospects that the lockdown could be lifted a little earlier than the 6th of September?
Thank you, Deputy Chair. May I just, I don't mean to take from Deputy Lawless, I have an answer on the flu vaccine delay, and it's 2 weeks, just for the information of the committee. So pretty much still on target, but a 2-week delay. Deputy Lawless, the NEFIT, as you know, is meeting tomorrow, and I have explicitly asked them to look at the profile of what is happening in Kildare, and that if there is a public health case to be made where it is the right thing to do and it is safe to accelerate the opening up, that is exactly the recommendation that I would get. I can't preempt that, and I don't want to create any false expectation. As we all know, the rate is very high in Kildare. The cut-off point for Ireland's green list was prevalence cases of no more than 5 per 100,000 over the previous 2 weeks. Kildare was at nearly 200, so the rate was very high. We also know that thanks to the incredible work of people in Kildare, that has been stopped and is now being reversed, and the 7-day rates are much lower. There's a very difficult call for NEFIT to make, which is, while the measures are working, have the measures reduce the community transmission to a point where it is safe to relax the restrictions, because we know the restrictions are working, and inevitably there will be risk if the restrictions are relaxed early to the community transmission spiralling again. So I salute what the people of Kildare have done. I deeply empathise with the fact that they are now the only county being asked to put in additional measures. And if they can be lifted early based on public health advice, they most certainly will be. But we need to be very clear, Deputy, that our absolute focus is on saving lives, which is what the people of Kildare have done, getting the schools open, keeping the businesses open, keeping the healthcare services open, and avoiding much harsher measures.
Thank you, Minister. And I just want to say that that would be such a relief and a reward to the people of Kildare. I appreciate public health advice is paramount, but any ray of light would be such a relief and a reward to the people who have been compliant and have done everything asked of them. Thank you, Minister. Thank you, Chair.
Thank you, Deputy. Minister, I'm hoping that you'll help me to understand what the current strategy is. At the beginning of this, we were told that the strategy was to flatten the curve, that the virus would spread as viruses do, but that we needed to flatten the curve to ensure that our health system wasn't overrun and we didn't have scenes like we had in Italy and Spain. At that time, when the restrictions were introduced, numbers were rising from 170 in hospitals to 440, from 50 in ICU to 80. 4 months ago, on the 29th of April, there were 1,185 cases in hospital in Ireland, of which 120 were in critical care units. 3 times today you told us that you were looking at a complete lockdown and that we were at tipping point. We've been hearing about a lot of tipping points, though. We've heard about tipping points now since June. We were also told today by the HSE that there were 22 patients admitted to hospital with ICU and 22 admitted to hospital with Covid-19 and 6 in ICU. Now, I accept that for those 22 patients and their family, and in particular the 6 in ICU and their families, that it's an incredibly worrying and stressful time. But what I don't understand, Minister, is how you can possibly talk about a national lockdown given those figures and given that our health system coped with 1,185 4 months ago. So I want to know, what is the strategy here? What are we hoping to achieve, if not that our health system is not overrun? Because Dr. Glenn earlier this week, I note, accepted that we cannot eliminate the virus, and that seems to be the general. I accept that there are those who are calling for it to be eliminated, but he said that he doesn't think we can eliminate it here. There's a growing acceptance that you can't eliminate it, and if you do, what do you do then? You open up and you go through the same cycle. You're talking about lockdowns, and you said a couple of times that they work. Argentina has been in a lockdown for 6 months. Figures are spiralling. Earlier this week, we had the WHO on RT News saying that lockdowns don't work. It was a Hans Kluge, who was the European director of the WHO. So, where are we going? What is the strategy?
Thank you, Chair. So, first of all, you're absolutely right. I have mentioned a tipping point several times, but it's not me making that up. I'm saying it because that is NEFIT's position. And I think it's natural, Chair, that we all become fatigued with this.
No,
people have been through an awful lot.
How can you...
And the reason, Chair, that I am emphasising it and re-emphasising it is because we need to be on our to be on our guard. In terms of your question on do lockdowns work, well, we know they work because we did one here and it worked. They did them across Europe and they worked. If the purpose is to flatten the curve, we locked the country down, that the curve was flattened. And that has been the experience of most of the countries we've looked at.
We have no idea how many people are unable to bear. You talked about causing unnecessary anxiety by the use of the word trampoline, and I very much accept your explanation. But talking about another lockdown in circumstances where we have, and again, I repeat, 6 people in ICU, and I regret each and every one of them desperately. I lost a very close relative of my own earlier this year, and I know no matter what age somebody is at, you know, you don't want to lose somebody close to you. Of course you don't. But we're talking about national priorities. We have 6 people in ICU, 22 in hospital with COVID-19. At the height of this, we had over 1,100 people in hospital and 120 in ICUs. And you're talking about a lockdown again. Have you any idea of the effect that that's having? Forget about the economy for a moment, but we can't forget about it for too long because something has to fund our healthcare system. They don't fund themselves in any country in the world. Have you any idea the effect that that's having on mental health, on people's psyche, on people's spirit, on what's happening in the country now? How can you possibly talk about a lockdown, given that the figures, it flies in the face of reason? And we all have eyes, we all have a capacity to reason. You know, we're all live in a post-Enlightenment world.
Thank you, Chair. Of course, I do understand the implications, which is why I keep saying it. It's why we brought in the measures last week, is because we must suppress the virus in our community. A huge national priority has been getting the schools open for many of the reasons you say, and that's now happening because the transmission has been reduced. But Chair, I think your question is fair in that you're saying, look, the number of cases is going up, and we know it's going up very quickly. So, for example, the key measure that the public health experts use is the number of cases over the last 2 weeks per 100,000.
The number of detected cases, we've no idea really what's happening outside of detection levels. Is that a fair thing?
We do. There was a study done estimating that the total number is about 40 to 50,000 versus the 27, 28,000 we've detected.
There are other studies that are being prepared that may or may anyway.
Okay, look, the ones that the experts talk to me about are that one, that we've detected probably a bit over a half of the total cases. But Chair, this figure that they use, we were at 3 per 100,000 a while ago. 2 weeks ago we were at 18 per 100,000, and today we're at 30 per 100,000. So let's be very clear. This virus is rising again quickly in our community. Now, I think you very fairly ask, well, how is that linked to hospitalisations? Because the cases are high, but the hospitalisations, thank God, are low. Go back and look at the profile of what happened the first time. And what you'll find is that at this point in the pattern, as the cases were in and around where they are now and rising rapidly, hospitalisations were also very low. So the unambiguous message and advice from Public Health, Chair, is that death will follow high numbers of cases. So what we don't want to do is wait for the hospital system to be overrun. We don't want to wait for fatalities to go up and up and up before we act. We have to act first, and so that's what we're doing.
But Minister, that line, that deaths will follow increase in detected cases, it hasn't happened across North America. It hasn't happened, thankfully to date at least, across Europe.
Chair, the situation in North America, with the greatest of respect, is not one we need to be looking at to learn lessons from.
I'm not saying, Chair, that Donald Trump is doing a good job, and please don't mischaracterise me. I'm not.
And I'm not. I'm not.
What I'm saying is that the increase in detected cases has not been accompanied, and it's a trend that's going on for some time in North America and the continent. It hasn't been accompanied by an increase in hospitalisations and deaths. Thankfully, that's all I'm saying.
I appreciate that, and just go back and look at the profile that happened here in March and April. And if we were back in March and April, we could well be having exactly this conversation. You could be saying, yes, cases are going up, but the hospitalisations haven't happened at a big level. Therefore, do we need a lockdown to flatten the curve? And of course, as we all know, we've had nearly 1,800 deaths. And the answer is yes, what we did was necessary. So there are no easy answers to this, Chair, and what we're having to do is move early to stop the fatalities and stop the critical care admissions and stop the hospitalisations. And I would just emphasise again, Chair, the success of Kildare, Laois and Offaly is that the communities there have shown that relatively reduced measures, certainly compared to a lockdown, not only do they work, but they work very quickly. And simply that is what we're doing. And Chair, I'm more than happy to stay for as long as you want and answer any questions. But if you'd allow me to just make the following ask and say the following thing as well. Speed matters. So how fast we moved in the 3 counties mattered. How fast we're moving in terms of the national measures matters a great deal. And critically, how quickly individuals respond matter. So there's very rightly in the committee been a lot of focus on the turnaround time for testing. Absolutely right. And we'll continue to bring that down and down and down. But you know, the other part of that is the individual responsibility we all have to take. So my ask is for people, if you feel symptomatic, to not do what we all do in the normal world, which is to wait a few days and see if we'll be okay, is to go immediately to the GP. So, Chair, if we all act, if we all move early and put up our hand and say to a GP, yeah, I've got one of the symptoms, can I get a test? If we follow the public health guidelines around social distancing and face coverings and the other things, we will move through this without the harsher measures, and that is exactly what it is we're trying to do. For example, we've obviously got to open the schools, but in my brief, we have to get the healthcare system back up to capacity, and higher capacity than it had before, because of the enormous number of men, women and children waiting for healthcare.
And I know that you're going to provide the committee with the figures on how that capacity has increased in the coming days, and I thank you. Minister, I just join with you in asking people to behave responsibly, to take personal responsibility for their actions, to adhere to the measures that have been outlined. But speaking personally, I really would caution about talk of another lockdown, because there is a risk of unleashing a whirlwind. That's my personal view. I really am not convinced that you will bring the country with you on that.
Yeah, thank you, Chair.
And that's not a committee view, that's a personal view.
Yeah, and I accept that, and I fully accept your view. But Chair, we're in a world where there are no easy answers. We are dealing with a global pandemic and a highly effective, vicious virus that we know kills people, and there is emerging evidence as to some of the longer-term health impacts for people who don't die. So
have the figures on the number of, we're consistently told that young people suffer long-term effects, and I've no doubt that that's true. Do we have the figures on how many young people have long-term debilitating effects from COVID-19? Or even people, forget about young people, but how many people who have overcome it, who have gone back to, got to the stage that can go back to their day-to-day existence, whether that's as students, as workers, or as retirees, but who suffer long-term debilitating effects? Do we know what percentage that is in Ireland?
Well, Chair, by definition we don't, because we haven't had the virus here long enough.
No, but we know that
to be able to,
we should have a figure up
questions.
now.
But what we can say is there are very sobering case studies which medical experts are looking at around long-term issues, including respiratory issues and others. But, Chair, the reality is we don't know what the long-term effect is. So we don't know yet. The doctors, the scientists, they don't know if there are subtler, longer-term health complications for people who get this virus. They don't know that yet. And we won't know that, obviously, by definition for a while. But they do point to other diseases where there are long-term impacts. And so at the moment, and I hope you would agree with this, and I take your points on, they're very reasonable, but I hope you agree with this, that given that this is a novel virus, unlike anything you or I have ever seen, and given the loss of life that it has caused already, and given the very serious warnings we have from doctors and scientists saying there may well be longer-term issues with this, I hope you would agree that we've got to do everything we can to suppress the virus. And right now, you asked at the start, what's the strategy? Right now, Chair, the strategy is to use the targeted measures, as we are, and to work as a nation in solidarity to follow basic but very effective infection control measures to suppress this virus and get on with opening our society, opening our public services, opening our economy and protecting jobs.
Thank you, Minister. I just want to ask a question of more local interest to me. I don't expect a reply now, but maybe you could provide one in writing. It was the HSE told us earlier today that the department had engaged the DAA to carry out the follow-up calls for people coming into the country. I suppose I'd like to know what tendering process was done around that, or how Dublin Airport was selected over, for example, Shannon Airport, which is now going through a round of redundancies, you know, because there's a lot of capacity there too, and sometimes it appears that there's only one airport in the country when it comes to Irish officialdom. If you want to reply now, you're welcome to, but otherwise I'd ask you to reply in writing. It's up to yourself, Minister.
Thank you, Chair. No problem at all, and I'll get you more detail in writing, but the short answer is actually the Department of Health has procured the contract.
Yeah, with the Dublin Airport Authority, but how?
No, with a private firm to do the work. So the DAA was originally looking at it, but it was my department has taken that over and procured the contract.
Okay, yeah. Thank you. Look, there are a couple of other issues I'd like to raise, but I've taken enough of your time. I thank you very much. Before concluding, I wish to thank you for coming in, Minister, making yourself available. I appreciate it's a busy time, and it's a very busy time for your officials. I'd particularly like to thank Mr Malone here, who I know has to work through his holidays to organise today's meeting, and Ms Sarah Kremen from the Secretariat, who also put in a huge amount of work to make this happen today. I'd like to thank them very much on behalf of myself and on behalf of the committee members. And then I'd like to just adjourn the committee until 10 a.m. on Wednesday, the 2nd of October. Thank you all very much.